Hello and welcome everyone. I'm Lieutenant Colonel Lindsay Marquez. Today I have focused my tech talk for this course assignment on a current issue that my students and I are facing. I wanted to discuss a crucial methodology for advancing our USU nurse anesthesia curriculum to ensure that our graduates are exceptionally prepared for neuraxial procedures. The focus of this talk is about utilizing simulation to enhance long-term skill retention for neuraxial procedures. The neuraxial procedures that I am referring to today, specifically talking about epidurals and spinal procedures. So these procedures are among the most technically demanding skills that we teach, and the core challenge that we face is not just teaching the skill, but also ensuring that it's retained. So without consistent practice, this specific skill will fade quite easily. This presentation outlines an evidence-based approach to ensure our trainees maintain high proficiency not only during their training, but utilize this as a method throughout their careers. Our students specifically will get a little bit of a hands-on during their initial didactic training, and then it may be several months until they will be put out into an OR setting or back into a labor delivery floor, and they might even go months more gaps in between that before they're going to do epidurals and spinals again. So being able to make sure that they can maintain this skill level throughout their training is something that we really need to look at and address. The solution to this is to formalize the use of simulation as a framework for deliberate practice. We currently utilize simulation for many aspects of our program, but we have not formalized specifically neuraxial procedures as one of those simulation aspects. And I really would like to create a different feel or a goal for these simulation sessions. This isn't just about getting in the time on the simulator. This would actually be a structured method of focused repetition with expert feedback in a controlled, safe-to-fail environment. This allows the residents to make mistakes, learn from them, and perfect their technique without any risk to the patient. The benefits to our trainees are really multifaceted. First and foremost is safety. Beyond that, we can see a direct correlation between this type of training and improved confidence and competence. Trainees can receive objective, data-driven feedback on their technique that is very difficult to provide in a busy and an urgent clinical setting. And ultimately, the simulation training bridges the gap between turning theoretical knowledge into a skill that they can rely on. What is really great about using a simulator for something like this is providing especially this needle trajectory, depth, and adherence to protocol, which is something that we really can't do, especially this needle trajectory and depth is very hard to explain on a laboring mom who's having pain or in an OR that is a little bit busier and fast-paced. So being able to do this in a setting that allows the student to walk at their own pace, get that expert feedback, and also feel like they are doing it where they're not causing any delays and it is safe for the patient is truly something that I think will offer a great benefit to our students. Crucially, simulation allows us to train for events that we hope our trainees will never see, but they do need to be prepared for. We can replicate a high neuraxial block or other critical complications, and this allows them to practice their management protocols in a controlled setting. And this is absolutely vital to ensure their readiness for any situation that they might face. So this idea isn't just a good idea, it's really an idea that's evidence-based best practice. Multiple studies, including systematic reviews published in leading anesthesia journals, confirm that simulation-based training of neuraxial procedures leads to better performance, better skill retention, and improved management of complications. The data is clear. This is the direction that we need to be going with our skill-based teaching techniques. So in conclusion, integrating a more robust and defined simulation curriculum is a direct investment in the quality, safety, and competence of our graduates. From this point, I would suggest forming a working group with our simulation faculty and program director to identify the best points for integration into our curriculum, develop standardized scenarios, and launch a pilot program with our next cohort of learners to really formalize this effort. Thank you for your time. I'm happy to answer any questions that you may have. Please utilize my student contact information listed within the course or my USU email that you see on the slide. Thank you.